So this will be a full foot treatment. The equipment you'll need will be a large soft ball, a large firm ball, and a small firm ball. Let's go. Standing in balance, bring your feet to parallel, body's nice and tall, chest is lifted. We're starting with a rest assess. Close your eyes, give yourself permission to come inside and just standing still and tall and quiet. Take several deep breaths. Start feeling where your body's standing in space. Notice the footprints on each foot. Notice if you feel the weight evenly distributed, pinky toe, big toe, and heel. Taking your attention up through the center of your legs. Notice the spacing between your legs. Feels more bowed or more, one leg feels more forward than the other. Or if you feel evenly weighted, kind of all the way up the midline of the body. Can you relax your glutes, your quads, your hamstrings? Does it feel like you're trying to hold yourself up, or can you just stand using your stabilizing muscles? Lift up all 10 toes. Notice your body reacquire its balance. And then as you take another deep breath, drop all 10 toes. And notice if your body wants to kind of shift or whoosh off into one position. All of these are positions just to notice as an assessment. So when we come back and reassess, you can feel, see, and understand with more clarity how your body's reflexive balance sees itself. Go ahead and open your eyes. Grab the large soft ball. So starting with one foot, on here is all the position points. We're going to start position point 1, which is just about in the center of the foot. Begin to shift your weight back and forth, looking for tolerable pressure. You're never looking for pain. You're never trying to push the ball down as hard as you can. It's always looking for tolerable pressure. Just shifting side to side, trying to feel that evenness, right and left side. Taking nice long deep breaths, feeling comfortable and at ease with each movement. Pausing. Try to find balance between both feet evenly weighted. Take your arms up over your head and down. Trying to find each joint moving, giving sensory information all around the body. Stepping back with your left foot, move the right foot position point 2, which is below the big toe on that knuckle pad. Press down and release. Position point 2, second toe, third toe, and you can see the knuckles push up slightly. Fourth toe and fifth toe. We're not really touching the toes, just touching the knuckles. Position point 3A, at the base of the arch, hide the ball, press down, come back off. Position point 3B, you can see on the chart as well, below the knuckle of the big toe where the fascia really attaches. Press down and come out. Position 4 on the outside edge between the pinky toe knuckle and the front of the heel. Press down, that is the lateral arch, and come off. And then we're going to position point 5, which is where the arch meets the heel. Press down and come out. Staying in that position, you want to re-enter that space about 50 to 70%. Holding there and then beginning to glide. Moving that heel side to side, continuing with consistent pressure. Now begin to move that ball back to the heel, pin it behind the heel. If it gets out of the way, restart again, and then again, move back and forth. So you're moving down to the back of the heel, and then forward to where the arch meets the heel. Think of almost circles of movement. And then pause. Right where the arch meets the heel again, take the weight out, put back in as much as you can tolerate, and we'll start with what's called a shear. It's a transitional or a transverse movement against the tissue. and then pause. Move the ball back to position point 2 and then press the ball to the heel. Position point 2, second toe, press the ball to the heel. Third toe, press. Fourth toe, press. Fifth toe and press. And then we'll do friction. Move the ball in any direction that works. Underneath the toes, move the arches, and then pause. Bring yourself back. Just do a quick check-in. Notice if you feel any more fullness, evenness of weight on that leg. Starting with the second side, put the ball underneath the center of the foot. Now the ball movement, especially large soft, is a preparatory tool, but it can be a complete movement practice as well, especially if you're moving on to the small or the large firm balls. Go ahead and pause. Take your arms up over your head, arms down, roll yourself and come back up. Move the ball to position point 2. So repeating the same things on each side. Position point 2, third toe and fourth toe knuckle and fifth toe knuckle. Each side may feel a little bit different. Move the ball to position point 3A, hide that ball, little twist. 3B, and then 4. Move the position to position point 5, press in, come back out completely, and then return in for about 50%. We'll go back to that glide. Move that ball down towards the heel. And this can be a little bit bigger of a movement than that shearing motion. Just controlling the ball. Now notice I'm keeping the ball of my foot on the ground as the heel of my foot is in contact and doing more of the motion. One more time to the heel and back to the front of the heel where the arch meets the heel. Pause, move in, move back out, move in about 50% to 70% maybe, and give it that nice tight shear. Again, this is moving the tissue, not so much more moving the ball. After a shear, we want to pause, keep some pressure on that ball, let the tissue respond, and then come off. Moving into a rinsing motion from the big toe knuckle, second toe, third, fourth, and one more, fifth. We're moving that tissue through. Pause, and then we're going to do our friction. Just a multi-directional movement on the ball, and then pause. Let's recheck in. Notice where your body's in space. If it's just easier to stand here using your stabilizer muscles instead of those larger mover muscles. Lift up all 10 toes and drop all 10 toes. And see if your body's reflexive balance is taking more control, more awareness. Let's go to the small firm ball. Let's go to the small firm ball. You're going to take that ball and put it in position point 1. This ball is much firmer than the large soft ball. It also can help you with your position point pressing because it's a little bit more fine-tuned. But you also may need to be aware of your ability to tolerate pressure. So right through the center of the foot, you can see position point 1, press down. Just rock back and forth. Much more position, much more pointed pressure. Pause, take those arms up, take those arms down, and roll. And then come back up. Move the ball to position point 2, underneath the big toe, press down. Remember, this may be a lot more tender, so go in gently. Underneath the third toe, and fourth toe, and fifth toe. Position point 3A, press down, come back out. 3B, press in, and come back out. Position point 4, press, and position point 5, press. That's it. That's all that we're going to do with that ball. We're going to do the same thing on the second side. Now, sometimes in the second side, it's even more tender, And so be aware, you may need to put more weight onto your standing leg. Just come in and come out, come in and come out. All of the ball treatments can be done seated, so there's less of your body weight pressing down as well. Pause, take your arms up, take your arms down, and roll down and back up. Move the ball to position point 2, under the big toe. Press down, press down, press down. Position point 2 under the pinky toe. Underneath the position point 3A, where the arch meets the heel, where the knuckle meets the soft tissue of the arch. Over to the outside edge, position 4, press down. And position 5, where the arch meets the heel in the center. Tender for some of you. Me too. And then release. We're going to go back to the large softball, and we're going to rinse the foot. To kind of move that tissue. Anything we've opened up, we want to rehydrate. And then friction. And then again, the same thing with the other foot. Big toe to heel, second toe to heel, third, fourth, and fifth. And then friction. All right, let's move these two balls out of the way, and we're gonna grab the large firm ball. Large firm ball, you wanna make sure that you give the opportunity for the foot to take in the weight. So we're not gonna put our whole body weight. So we wanna start with the ball about the center of the foot with my heel still on the ground, and I'm just rocking back and forth. Now, if you can put your whole foot weight in, notice I still have weight in my standing leg. I'm not balancing on the weight of the ball. I'm just pressing gently in and coming back out. And then pause. Same thing, take those arms up, take those arms down, roll to your right, roll to your left. Good, let's move the ball to position point 2, press down, press down. You can feel how the ball wraps around the foot. Position point 3A, press down, 3B, press down, 4, press down, and 5, press. So we're gonna begin with our, take your weight out, I'm lifting my heel up, pressing my heel back down, see where I can find tolerable pressure. Now this could be a 30% pressure, maybe as much as 50% pressure. You're definitely not doing 100% because you probably can't stand on the ball. Just go from side to side. You may notice the control you have over the ball. You may notice some tingling, some movement in the fluid of the tissue. Move back and forth. Move the ball towards the heel. Again, I have weight in the ball of my foot, the front of my foot. Moving the ball to the heel. Moving the ball to each side of the foot as far as I can go. One more time, one more pass. And back. Now on this ball, if I want, there may have been a tender spot, maybe that feeling of rice or glass in the foot. Go ahead and find that spot, press up against that, and do your shear up against that spot. Not necessarily right on top of it, but to the side of it. Thinking of kind of digging out something. Pause, and we're going to rinse all the way big toe to heel, and we're going to do that one more time. Good, and then go back to your glide. And then find a second spot if you would like. I'm going to go down here towards my heel and back and forth. And you could go to that first spot, right where the arch meets the heel, and that's totally fine. Pause, let the tissue respond, and then rinse again. Try to maintain consistent contact, and then friction. Open the toes a little bit more, hit the arch a little bit more, outside edge, pinky, and then pause. Good. If you want, reassess, standing there. You may notice a bigger difference on that right side or the first side than you are on the second side. Let's go to the second side. Remember, heel starts on the ground. Let the foot's weight, let the body's weight drop into the ball. Notice I'm not totally taking my weight completely on the ball. You could just press like you're pushing down on a pedal without putting more weight really into the ball. Or you can put more weight into the ball. Pause, hold, take your arms up, take your arms down, roll yourself forward, and roll yourself back up. It's just giving information of balance to your body. Move the ball to position point 2, press down, third toe, press down. Remember, I'm hitting the knuckles, press down, and 5, press down. Position point 3A, where the arch meets the heel. Hide that ball, press down. Position 3B, underneath the knuckle of the big toe, not on it, press down. Onto position point 4, between the pinky toe and the heel, press down. And position point 5, press down. And let's take the weight out, put the weight back in, and find that glide. Move that ball from arch to outside of the foot as best you can, like you're going around the front side of that heel. Then beginning to move the ball down across the heel and then back to where the arch meets the heel. Again, you may again be noticing, you can go slower here, spots of tenderness, little pieces of glass, little pieces of rice. The tissue you're breaking up in a sense a little bit, not breaking up like breaking up fascia, but kind of like you're just breaking into feeling stuff where you can't feel the same all the time with your large soft ball. Go ahead and pause. And then we're gonna do a find that spot. I have my ball kind of on the inside of my heel and I'm rubbing right up against it or shearing against, cross frictioning the tissue. And just a tight wiggle, and then pause. Good, and then let's rinse. Rinse from toe to heel, toe to heel. You can rinse instead with the large softball if it feels better and more balanced. One more time, and then let's get some friction in there. And then pause. Let's do it one more time. Find a spot. And then you're going to go back and forth. Tighten that wiggle right up against that area. It could be the same spot you did before. It could be a new spot. Pause again. And let's rinse again. One more time. And then friction one more time. Then we're going to immediately do friction again on the first side because we've been standing on this leg for a while. Pause. Let's do friction on the first foot, same ball. Second foot again, same ball. You could go to the lighter ball if you want, the large soft, and then pause. Let's go back and reassess. Take a deep breath. And just notice how you're standing now. You may have unearthed some things. You may feel fuller. You may feel like you have a different sense of your weight. You may feel very grounded. Again, your eyes are closed so you can feel the body from the inside. Notice that inside, the inner side seam of the legs. Lift up all 10 toes. See if you're balanced and you can acquire balance a little bit easier. Take a deep breath and exhale. And notice if you stay more centered, more balanced as well. Take another deep breath. Ideally, your weight is big toe, pinky, and heel. Open your eyes, take your arms up, take your arms down, Roll yourself forward and roll yourself back up. I hope you enjoyed this session, just understanding a little bit more about how your body responds to the ground force, how your body responds to your thoughts and your movements, and giving yourself and your tissue a little bit of opening and awareness. Remember, the key parts of the melt process are to reconnect, rehydrate, return the body to its natural balance, and restore better movement. I hope you enjoyed this. Have a great day.